Intrauterine device, chemical barriers, diaphragm, cervical cup, female condoms, and surgical method. What is intrauterine device? An intrauterine device (IUD) is a small T-shaped object containing progesterone that is inserted into the uterus via the female reproductive organ. It prevents fertilization by creating a local, sterile inflammation condition to prevent implantation of the zygote. The IUD are fitted only by a physician and inserted after the woman's menstrual flow. The device can be effective for 5 years to 7 years. How it works. The IUD is similar to the insurance system iOS, but instead of releasing the hormone progesterone like the iOS, the IUD releases copper into the womb. The copper alters the cervical mucus, which makes it more difficult for sperm to reach an egg and survive. What is the importance of intrauterine device? IUDs gives you great long-term protection against pregnancy. They're more than 99% effective. They work as well as sterilization and the birth control implant. IUDs are one of the most effective methods you can get because there's almost no way you can mess it up. Chemical barriers. Chemical barriers such as spermicides, vaginal gels, and creams and glycerin films are used to cause the death of sperms before they can enter the cervix and to lower the pH of the female reproductive organ so it will not become conductive for the sperm. On the other hand, these chemical barriers cannot prevent. Chemical barriers destroy pathogens of the outer body surface at body openings and on inner body linings. Sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. What are the two chemical barriers? Once inside, the body still has many other defenses, including chemical barriers. Some of these include the low pH of the stomach, which inhibits the growth of pathogens, blood proteins that bind and disrupt bacterial cell membranes, and the process of urination, which flushes pathogens from the urinary tract. Diaphragm. Diaphragm is a circular rubber disc that fits the cervix and should be placed before coitus. Diaphragms work from the inhibiting the entrance of the sperm into the female reproductive organ, and it works better when used together with a spermicide. The diaphragm should be fitted only with a physician and then should remain in place for 6 hours after coitus. How does the diaphragm prevent pregnancy? Using a diaphragm is a form of birth control. It prevents pregnancy by creating a barrier between a woman's uterus and a man's sperms. A diaphragm is a reusable dome-shaped cup. It fits over the opening of the cervix. Cervical cup. The cervical cup is made of the soft rubber and fitted on the rim of the cervix. It is shaped like a cymbal with a thin rim and could stay in place for not more than 48 hours. How the contraceptive diaphragm or cup works. A diaphragm or cup is a rare method of contraception. It fits inside your vagina and prevents the sperm passing through the cervix. You need to use it with a gel that kills sperm. Male condoms. The male condom is a latex or synthetic rubber sheet that is placed in the erect male reproductive organ before penetration into the female reproductive organ to trap the sperm during ejaculation. It can prevent STIs, and it can be bought over the counter. Male condoms have an ideal fail rate of 2% and a typically fail rate of 15% due to a break in the sheet's integrity or spilling of semen. Why do guys wear condoms? You can use condoms for oral, anal, and vaginal sex, so they protect you from STDs, no matter how you get down. And that's really the success part of all. Condoms let you can focus of pleasure in your partner without worrying about pregnancy or STDs. Safer sex is better. Sex is because it stops stress from killing the mood. Female condoms. Female condoms are made of elastic rubber sheets that are pre-lubricated when spermicide. They are usually bound by two rings. The outer ring is first then inserted against the opening of the female reproductive organ and the inner rings covers the cervix. It is used to prevent fertilization of the egg by sperm cells. Are female condoms just effective? The female condom is about 75% to 82% effective with normal use when used correctly all of the time. Female condoms are 95% effective. Female condoms can fail for the same reason as male condoms, including there is a tear in a condom. Surgical methods. During vasectomy, a small incision is made on each side of scrotum. The vas deferens is then tied, cauterized, cut, or plugged to block the passage of sperm. The patient is advised to use a backed-up contraceptive method until two negative sperm count results are recorded because the sperms could remain valuable in vas deferens for the process of surgical method, which involves the female sterilization and results in a permanent abolishing of pregnancy, is known as surgical contraception method. It involves the method of tubal ligation of the female reproductive organ, particularly the oviduct. Why surgical methods are the most effective methods of contraception? Hormonal methods, when used properly, are highly effective and offer numerous non-contraceptive benefits. Long-acting methods are also effective and depends less on user compliance. Surgical methods are the highly effective but are mostly irreversible and therefore are offered to multiparous older women.